In this, our final podcast on the urinary system, I would just like to review some histological images of the organs that we have talked about. So here is a very, very low power view of the kidney, so low indeed that you can't hardly even see renal corpuscles up in the cortex. But it's a nice image in that you can get a clear appreciation for a structure like a renal pyramid. I'm highlighting that here in the medulla. So this would be a renal pyramid. Down in these regions would be the calyces of the kidney, and here are some cross sections of some of the large blood vessels that are coming into the kidney. A low power view of the renal cortex. You can see at this fairly low power view renal corpuscles, and you can see some profiles of the medullary rays. And remember, the medullary rays contain the straight portions of the proximal and distal tubules and the collecting ducts. Again, a relatively low power view, but here at the junction between the cortex and medulla, and I know this because you can clearly see the arcuate artery and arcuate vein, and you should remind yourself of why this is the artery and this is the vein. You can tell the artery because of the much more substantial layers of smooth muscle here. Renal corpuscles clearly seen, and some profiles of the medullary rays like this. And then the medullary structures on the right-hand side. A little bit higher power view of the renal cortex. Here is a renal corpuscle with a glomerulus showing. Here are proximal convoluted tubules and some distal tubules, this being a distal tubule here, another distal tubule here, perhaps another distal tubule here. In this distal tubule near the renal corpuscle, you can see the macula densa. In these proximal convoluted tubule cells, you can note the PAS positive nature of the brush border. Here would be some profiles of the cortical collecting ducts. A higher power view of a renal corpuscle, I can clearly see the urinary space. You can see the parietal layer of Bowman's capsule. Here I'm looking at the visceral layer of Bowman's capsule. I cannot distinguish in the light micrograph differences between the endothelial cells and the podocytes. Here is a vessel coming into the renal corpuscle, or it's a vessel coming out. So this is a profile either of the afferent or efferent arteriole. I don't know as I look at this. Here is a profile of the distal convoluted tubule with the macula densa shown right here. Here would be some cells that would be extraglomerular mesangial cells, but I can't distinguish these extraglomerular mesangium with certainty from JG cells that might be part of the afferent or efferent arteriole. And then some profiles of proximal convoluted tubules. Again, a higher power view of renal corpuscle with the glomerulus. Here I'm seeing some of the cells of the macula densa, urinary space, and then a little bit of the transition between Bowman's capsule and the proximal convoluted tubule being shown right here. Again, a higher power view, renal corpuscle. Here, the urinary space flowing directly into the proximal convoluted tubule. And again, some views of proximal convoluted tubule. You can see the PAS positive nature of the brush border. This probably a distal convoluted tubule. Look, you can see more cells around the area of the distal tubule. The cells are a little bit smaller, so you see more nuclei. Here on the extreme right may be a profile either of the distal convoluted tubule, but more likely part of the cortical collecting ducts. And I'm making that comment on the fact that I see some distinct cell boundaries here, whereas in the proximal convoluted tubule cells and in the distal convoluted tubule cells, the boundaries are not distinct. Here I've got a region in the medulla of the kidney. I can see profiles of vasa recta. I can see thick limbs of Henle's loop, like for example here. I can see some thin limbs of Henle's loop. Here's a thin limb here, maybe another thin limb here, and then I can see some profiles of collecting ducts. Very large profiles of collecting ducts here, profiles of collecting ducts here. Look at the lighter and darker staining cells that you can see in some of these profiles of the collecting ducts. An area deep in the medulla of the kidney here where these collecting ducts are coming together or merging into the ducts of Bellini, like so. Another one of these large collecting duct profiles here. Thin limbs of Henle's loop shown here or here, maybe at these thin arrows, some thin limbs of Henle's loop, and then profiles of vasa recta shown here at the thick arrow heads. And you clearly know these are vasa recta because you can see red blood cells in the lumen. Otherwise, as you were to look at the deep parts of the medulla and you look at thin limbs versus vasa recta, it's very difficult to distinguish thin limbs from vasa recta, except for the fact that the lumens of the vasa recta will have red cells present, whereas the thin limbs obviously don't have red cells. And I don't see any thick limb profiles here because I'm very deep in the medulla. Here is a cross section of the ureter. I can see lamina propria and I can see some of the smooth muscle. A little bit of the adventitia off at the edge, and just a higher power view of the mucosal surface of the ureter, showing the transitional epithelium with these dome cells. And here actually you can see some cells that might be binucleate.